All right, guys. This is going to be my 3 month post exosomes update. It's kind of going to be a hasty video because I just have a really short time to shoot it. Because I'm alone for, I don't know, maybe 30 minutes this morning. And it is a bit overdue. Today is May 6th. And I was going to wait until I saw my doctor. I saw my doctor on Wednesday. So today's Friday. I saw her Wednesday. And I wanted to see her first before I reported to you guys this update and let you guys know what's going on. Um, you know, she told me everything's fine. I'm kind of not convinced because I mean there's a lot. I don't want to talk too much about her. I did find out some other details. There have been people in the Facebook group asking me some details about my dosage and stuff like that. So I will let you guys know. But there is some information that I can't disclose, for the safety and protection. Well, not the safety, but for the protection of the people involved. You guys know these treatments are very controversial, especially here in the United States. I can't disclose where I got it done or where the product is from, but I do think that it's essential for me to keep you guys updated and let you know whether I'm progressing or whether it's made me worse, because like I said, these are very expensive treatments. And there are a lot of people out there trying to rip us off. I've talked about that in other videos, so I just want to make sure that I'm making these videos and they're coming out, in real time or as close to real time as possible. That way you guys can also make a decision. And I know that there's a lot of people that are right now probably dealing with long COVID or complications from COVID and that are looking into exosomes and stem cells. And so I feel like it's essential to kind of get these videos out. But I also want to let you guys know that your experience may not be exactly like mine. I do have, from what my understanding is of my own illness, and also looking at the dosage that I know what dose I got of exosomes now. I'm guessing my condition is much more complicated and probably more severe. There's a lot more neurological stuff involved. So you may not need as big a dosage or as strong a treatment, but again, it's up to you and your doctor to decide that. So I did post a video. I think the last one I posted to the exosomes playlist, I was talking about how the IVIG was causing some kind of issue. Now, my doctor had advised me I had to stop IVIG 2 weeks before and 2 weeks after the exosomes infusions. So that's almost like a total of 5 weeks, because it's 2 weeks. The exosomes were infused over the course of a week and then 2 weeks after. So that's about 5 weeks. And then after those 2 weeks post exosomes, I could go back on my IVIG. I went back on my IVIG and I told you guys I was having like bad headaches, neck pain at the beginning. And then a few weeks later, I reduced the dosage of IVIG back to my 5 grams. I think I went down to 5 grams and then up to 7.5 grams. And the head and neck thing was better, but then the thoracic tightness and pain just got horrible. I mean, it was really, really bad. So I started noticing this kind of pattern where I would get to the end of the week when I was due for my next IVIG infusion, and I would kind of start feeling better. Like I would feel increased activity in the thoracic area, muscle twitching, and then suddenly, like 24 hours later, nothing, just tightness and pain. So I told the doctor, I said, look, I stopped IVIG. So I stopped IVIG, I think 3 weeks ago was my last infusion. And, I started noticing, again, increased activity. Increased activity in the pain, the thoracic pain and tightness was slowly coming down. And I mean, slowly coming down. Like at first, I wasn't really even sure how much it was coming down, but it was slowly coming down. By the way, I know I look really pale. I think it's the makeup I put on. I'm not really this pale, and it's not, anything that any treatment that I'm doing right now. I didn't put on enough makeup. I really wanted to make this video and get it out to you guys as soon as possible. So I look like a mess. I'm still like in pajamas and stuff. So I just stopped the IVIG, and I thought if the exosomes are going to do what they're supposed to do, they should pick up wherever the IVIG left off. I should not feel worse, I guess. I either am going to feel the same or continue to get better. So I have noticed that the pain is slowly coming down. Now, don't misinterpret that as I'm getting better. Remember, I flared up really, really badly. I don't know if that was the exosomes or the IVIG. I'm guessing it was both the exosomes and the IVIG, and I flared up a lot. So I'm coming down from the flare. So I'm not reporting that I am feeling better, that my neurological symptoms are getting better, or that I'm getting better. It's just the flaring, this flare up seems to be coming down. So I feel like I'm slowly returning to baseline. And like I said, slowly, really slowly. So I've been 3 weeks without my IVIG. Obviously, that is going to present some additional problems because the IVIG is prescribed by a different doctor. So I guess I will address that at another time if you guys are interested in that. If any of you are on IVIG, which I don't think I know anybody else in that Facebook group that is on IVIG, but it's essential to kind of, I guess, know this kind of stuff in case you are on IVIG and you're considering doing exosomes or stem cells in the future. I'm still worse than I was before. I'm still having increased thoracic tightness. My stomach has been kind of up and down. Like, I've been waking up. This week, my sleep was really bad after having, pretty decent sleep for a while. But this week, the first 2 days, bad sleeplessness. And then the second 2 days, I would wake up at 4 a.m. And then I would wake up really hungry, which is weird. And then, by the time it was time for me to get up, I was like, no appetite. So my stomach, my digestive issues, I'm not really seeing any clear improvement anywhere. Muscle activity seems to come and go. This past weekend, like I said, once I stopped the IVIG, it seemed like the muscle activity and stuff started, coming back. Like I was just feeling things. And this past weekend, there was a lot of that. And now it seems to have kind of slowed down again, and it just kind of tightens up. I think yesterday I was feeling a little bit of an increase in pain, but it does overall seem to slowly be coming back down to my baseline. And when I say my baseline, I mean my baseline before I did exosomes, which was still, there was still some stiffness. I was comfortable, I was stable, but I wasn't, I still was symptomatic. So right now, the last couple of days, it's been a little bit of increase in pain, but, the stiffness is still there. The tightness is still there. I'm still worse than my baseline, but I am happy because I'm not in as much pain as I was in. I mean, I was in so much pain. Like I wasn't like in blackout level pain, but it was definitely more pain that I had been in with my neurological symptoms. It was more pain than I had been in a while. And it was very uncomfortable. It's still kind of uncomfortable to sit. That seems to kind of make the tightness feel worse. And of course, I sit a lot throughout the day. So it was just kind of a nightmare. This treatment has been kind of a nightmare. I'm not going to lie to you. So I'm going to tell you guys the dosage. I cannot tell you guys the brand. I do know where the product is from. It is not commercially available. And, like I said, this is, the doctor explained it to me, and, I want to make sure to protect all parties involved. It's, these things are experimental anyway, so we really don't know what the long-term effects are going to be, if there's any negative effects. But the dosage, so I received 3 5 ml bags over the course of a week. So I think it was like Wednesday, Friday, and Sunday. So every other day over the course of a week. And each bag was 5 mLs. In those 5 mLs, I believe she said it was about 110 billion exosomes. I had 3 of those bags over the course of a week. So that would be over 300 billion exosomes. I did post this in the Facebook group. Somebody did comment and say that is an insane amount. And from what I've seen, from what other people have posted, it does seem like an insane amount. I think I've seen people post like 5 billion. I think I've seen people say 15 billion is kind of high. This is not a number that I've seen posted by anybody. So yeah, over 300 billion so far. So we don't know if there's going to be more coming. It's possible that there will be more exosomes coming in the future, depending on where I'm at. I had a 3-month follow-up with my doctor. I think in 2 months, I'm going to have another follow-up with her. Now, I'm going to end this video on this last thing because I may have to make a separate video on this because it kind of doesn't pertain to exosomes, but I'm guessing that my doctor knows something. She knows something, and like I said before, she doesn't explain things to me. So I was freaking out. She tested me for something called GAD56 antibodies. There will be a video uploaded soon, I think. I don't even remember. I did film a video recently talking about stiff person syndrome and talking about GAD56 antibodies. I was diagnosed with stiff person syndrome at the end of 2018, and I was diagnosed with 0 positive tests. I did not have a positive GAD56, or I think I had a false positive of another test, and then they did the EMG test, and nothing came up on the EMG. So I was diagnosed with no positive tests, which is very, very difficult. But GAD56 antibodies are associated with stiff person syndrome. So when my other video uploads, you're going to notice that I'm going to say that I had no positive tests and I was diagnosed with SPS with no positive tests. My doctor, for my 3-month follow-up, she tested me for GAD56 antibodies. I don't know why. She didn't explain it to me why. I didn't know that it was on the blood test. And I turned up positive. I believe my number was around 80, which is considered very low for stiff person syndrome. Now, like I said, I'm going to make a separate video on this. I don't know why she tested me for it. I do believe it's associated with neurological issues as well. I know it's associated with diabetes, but I believe it's associated with neurological problems because it's an antibody that is associated with not just stiff person syndrome, but some other neurological conditions. There was, I don't want to go into detail with my appointment because there was some kind of inconsistency with some of the things that she was saying. I imagine the reason that I am now showing these antibodies is because my condition got worse, because I'm flaring up. I have never tested positive for this. I've been tested 3 times prior. So I will try to do another video giving you more details on what GAD56 antibodies are. But for now, just know that she did test me for this post exosomes, and I turned up positive for the first time ever that I've been tested. And like I said, I was tested previously 3 times. I was tested twice by my neurologist here. Not my UCLA neurologist, but my regular neurologist. And then I was tested once at UC Irvine by their neuromuscular department, and I tested negative. And I was not able to get the diagnosis of SPS because I tested negative. At first I wasn't. It took me even longer. If you have these antibodies, I believe it makes the diagnosis easier. But like I said, I'll make a separate video. This will not apply, I think, to everybody, but I just wanted to throw it in here because it's the first time I've tested positive for this. And again, the doctor did not, she told me, she's like, oh, your levels are coming down. And I'm looking at her like, you never tested me for this before. So clearly I am panicking. And clearly I told her, I said, I may need to report this to my neurologist at UCLA. And she was kind of like, weird about it. But I was like, I need, this number is important. And she's like, oh, it's not significant. I'm like, then why did you test me for it? So I'll make another video on that. Just know GAD56, I believe, is associated with diabetes, but also associated with neurological conditions or autoimmune neurological issues, something like that. So I thought it was really weird. I don't know why I tested positive, but I imagine it's because I feel so horrible that's why the number came up. So overall, I am 3 months post. I have not seen any improvement. I am still slightly worse than I was before. The flaring seems to be slowly coming down. Even as I've stopped my IVIG, the flaring appears to be coming down. Right now I'm sort of plateauing. Oh, I also got a really bad gum infection, and I did see people reporting this in the Facebook group. They said that, and again, these are just regular people, not doctors. High doses of exosomes can suppress your immune function. I don't know how true this is, but I did get a really bad gum infection that took about 2 weeks to clear on the left side of my face. I didn't take antibiotics or anything because, again, I'm having issues with other medications and I did not want to throw in another variable. So I did get really bad gum infection on this side. Right now it seems to be a lot better. But now I'm having some kind of issue on the other side of my mouth, which I think is weird. Because I've been brushing, flossing, gargling with salt water to clear all that up. And it's weird that now the other side of my mouth is kind of being strange. So I'm guessing that there is some association with the exosomes, because I do tend to get irritation in my gums. Sometimes it can be hormonal, but this was like bad. I mean, this was really bad. It was painful. You know, there was some bleeding. It was really, really weird. As far as other infections, the usual infections that I get, I don't know. I don't think I've gotten any. But I mean, I think the point here is that I'm not feeling better. You know, I'm okay right now. I'm just happy. I'm just grateful that I'm not in as much pain as I was in. But I don't know. I still don't want to get my hopes up with this treatment because, you know, the doctor she's very intelligent, but she just does not, she kind of is very secretive. It's almost like she's like, I know what I'm doing, just trust me, don't worry about it, like that kind of, you know, attitude. And so I try not to question her too much. I'm not dying, so I guess I should be grateful that I'm still alive. But I will try to check in with you guys in another month unless something else comes up. I do have to talk. I am going to do a follow-up with my neurologist at UCLA because I've got to talk to her about some of these blood test results and about stopping the IVIG, which I'm very concerned about because IVIG is very difficult to get prescribed and covered by insurance, and she was able to do it with 0 positive tests. And I'm kind of not happy that I have to stop. The reason I'm stopping, I could keep receiving shipments, but I'm going to have bottles and bottles of this medication and nowhere to put them. And I don't want to waste this medication. It is very expensive. It's very difficult to make because it's made out of human plasma. And I just don't think it's fair. I don't think it's fair for other people that really need this medication for me to be just collecting these bottles. And there are people out there that need them to stay alive. So I feel like I'm doing the right thing, but I have to be very careful with whatever information I disclose because we all know these are very controversial treatments, and these doctors are really putting themselves out there. Even though I paid for this, they're putting themselves out there to do these treatments. They're risking a lot. So I haven't disclosed the cost yet. If you guys are interested, I guess let me know down in the comments and I will disclose the cost. The cost makes more sense now that I know the dosage. So yeah, if you guys want to know, but like I said, it's not a commercially available product. You can't go to your doctor and say, I want this product. So you may not have access to it. That's the only thing. So that's what I have for you guys. Quick, I mean, it was a lot longer than I expected, but this was a very hasty one, but I want to get it out to you guys as soon as possible so you guys have this information. So that's it. If you're interested in the GAD56 antibodies video, let me know down below. I will make a video of it at some point, but like I said, I film these videos while people are out of the house so I can speak freely and openly and loudly. So, but I will make that video eventually. Take care, you guys. I'll see you guys in a month.